My name is Dr. Frank Sullivan. I'm a radiation oncologist in the west of Ireland. I practice at the Galway Clinic and at the Hermitage Clinic in Dublin. My practice is predominantly looking after men with prostate cancer these days, although I do treat patients with other diseases when asked. But I want to put some thoughts down for patients with prostate cancer, especially in the midst of this COVID-19 crisis. My office has been receiving a number of calls, and understandably people are concerned, particularly with the inactivity due to the COVID crisis. And I wanted to try and capture some of the concerns and provide people with some reassurance in this difficult time. Yeah, the first thing to say is that notwithstanding the COVID-19 crisis, cancer services are continuing. They're mostly for patients who have an urgent need to be treated and for whom discontinuing their treatment would pose some problems in terms of worsening their outcome. But we are continuing, both in the private and the public hospitals, to provide these services. For example, in Galway Clinic today, there are approximately 40 patients receiving daily radiotherapy in our outpatient departments, and that has gone on unabated since the crisis started, and it will continue. We also know our colleagues are using chemotherapy, and there are some limited surgical procedures ongoing, mostly those who have high-grade or high-risk cancers or people with cancer emergencies. So people should be reassured that cancer services are continuing, and many of the patients you just asked me about are already part of that process. So there's no concern there, and those services will continue. In fact, over the coming weeks and months, we expect them to expand and allow more and more people back into the treatment net. Yeah, I feel particularly empathetic with these people because these men obviously have gone through a number of diagnostic tests over the last number of months, have been worried about prostate cancer, and the tests have now shown they need treatment, and then they've gone through the process of making the treatment choices, whether they have surgery or radiotherapy or different kinds of drug treatments for their prostate cancer, whatever it might be. They've been recommended to undergo treatment, and then boom, all of a sudden everything comes to a halt. So I can really empathize with these men and their families because they're very worried. They want to get on with their treatments, and they don't know when they're going to have the opportunity of doing so. So a couple of things I can say to these men. Firstly, you never want to say to a cancer patient that they're lucky, but certainly with prostate cancer, we feel that men have the luxury sometimes of time, and that not all prostate cancer patients need to be treated urgently or even emergently. So because of the slow rate of growth of prostate cancer, which is measured sometimes over months and years, we don't necessarily have to begin treatments urgently or emergently, and therefore people can wait. Now, not everybody can wait, but certainly a great number of men who've been diagnosed with prostate cancer can safely delay the onset of their treatments without impacting on their long-term prognosis or chances of cure, etc. Now, obviously, delaying the treatment, while it might not affect the cure rates in many men with prostate cancer, it certainly poses anxiety for them, and I certainly understand that, and we want to minimize that anxiety as much as we can. Hence, I'm putting some of these thoughts down. So if you have a low-grade prostate cancer, and for example, we think the best treatment for you is a course of external radiotherapy 5 days a week as an outpatient for several weeks, then many of those patients could afford to safely wait for weeks or months before they would start the treatment with no loss of long-term cure rates or good results. Similarly, if patients with low-risk prostate cancer who've been advised to undergo a treatment called brachytherapy, which is a minimally invasive radiation procedure done in the hospital under anesthesia in a single day, many of my patients are waiting to have brachytherapy, and similarly, many of those patients I would consider safe to allow them to wait so that the public health restrictions can be lifted before they start, and they won't have any less benefit in terms of their cure. There are some men, however, who have higher risk disease and who might need more than external radiation alone or brachytherapy alone. And some of those patients are either on treatment already, or some of them are waiting to start their treatments. The good news for these men is that very often we will use some medicines to delay the progression of the cancer as a part of our treatment, our radiation treatments. And the medicines I'm referring to are hormone therapy treatments. And many of our patients watching this will be either already on hormone blocking drugs, those drugs designed to block the male hormone testosterone, or waiting to start them. The benefit of these drugs is they can make radiation much more effective for cure in some men, but they also have a temporizing effect, so they can effectively halt the progress of the cancer, put it into a kind of remission state. And in that remission state, men needn't worry about the cancer progressing and threatening their life, but obviously they still have to wait for the radiation treatment. So without being able to cover everybody's particular situation, I think the message here is a great many men diagnosed with prostate cancer can in fact wait to commence their treatment with no loss of effectiveness. Some men are on medicines that will allow us to delay the onset of the radiation, again with no loss of effectiveness. And some men in fact are already starting their treatment because we deem their cancers worthy of not delaying and progressing on to them. So there's something in there for everybody, I hope, to reassure them that if your cancer is truly urgent or emergent, the services are there, we can take care of you, and we are taking care of you, and we will take care of you. But if you can safely wait, then our judgment is you're better off waiting, because there are risks, of course, in moving around in the context of this viral infection. Yeah, so these are men typically in the community who have a raised blood level called a PSA, and they've been detected by their GPs, and they've been referred into either a urologist or a radiation oncologist in the hospital for diagnostic testing. The testing they need, the tests they need are either an MRI scan of the prostate or a biopsy, or sometimes both. Now, clearly in this crisis, these tests are being deferred because the hospitals are being kept open to manage COVID and the urgent and emergent cases. So obviously this is causing anxiety for these patients. Again, I would have to say, for these men, prostate cancer in general, if you have it, grows quite slowly in the vast majority of men, and you're not going to lose any chance of cure by waiting a few weeks to months until this passes. So in general, men with prostate cancer can afford to wait, even though, again, there is anxiety which would prompt them to want to come in sooner. We think, on balance, the safety here is in waiting for the virus to be suppressed so that we can then get on to do these tests. So this is a constant fear for many people. They worry about cancer in general, and many men worry about prostate cancer, especially when they get into a certain age group where this becomes more common. We would not expect prostate cancer to cause symptoms, especially in the early stages. So if you have symptoms of urinary bother or anything of that nature, it's highly unlikely that these relate to cancer diagnosis. They're far more likely to be something benign and more easily treated, perhaps. So if you have any symptoms, talk to your GP. Most often they can reassure you. They may refer you in for some testing, maybe some laboratory studies, and then on for further testing with MRIs and biopsies if needs be. But it's very unlikely that you're going to be putting yourself in harm's way if you're developing symptoms of urinary bother at this time. So don't worry about those. Talk to your GP if you're concerned, and we'll take it from there. If you're at home and you're worried about your prostate cancer in any of the groups of men that we talked about before, and you happen to be a patient of mine, the office is open. You can contact Siobhan at 091-720-192 in office hours, and she will get a hold of me. You can call the Galway Clinic or the Hermitage Clinic and ask to be put through to me or my office, and during the day there'll be no difficulty. If it's out of hours, I'll call you back, and if it's an emergency, of course, you check with your GP, or you go to the emergency room in a standard way.